and welcome. You're watching Head to Head. I'm Antonina Antosha with UATV. As of today, the number of HIV-positive people in Ukraine is among the highest in Europe. According to estimates, at the beginning of 2018, there were almost 250,000 HIV-positive people in the country. Every 100th citizen of Ukraine aged 15 to 49 is infected with HIV. But this year, for the first time in decades, a decrease in the spread of HIV infection was recorded in Ukraine. To talk more about this, we welcome to our studio today Khrystyna Brodych. She's the director of the USAID HealthLink project. Hello, and thank you for joining us.
Thank you very much for having me here today.
Always a pleasure. So, as I have just mentioned, the numbers of HIV-positive people, HIV-positive Ukrainian citizens, has decreased by a little over than 0.5%. Now, while conducting the survey, while getting these numbers and putting them all together, did people who conducted the information receive any info on the temporarily occupied territories? Or is the result we have, meaning the decrease on 0.5%, is because of the lack of information from Lugansk and Donetsk regions?
Okay, the situation in Ukraine is the following, that yes, that's correct. We have about 240,000 of HIV positive people in Ukraine, and about 40% of those don't know about their status, and whether the decrease of the total number of epidemic in Ukraine is due to the fact that the epidemic is getting down, it's questionable. There are different suggestions why is that so, but we don't have. I mean, in Ukraine there is no clear understanding why it's happening. We haven't had research on how many people do live actually in Ukraine for the moment. The last time we had a national-wide research was in 2001 or so, and how big population do we have in Ukraine in general, not only about HIV. So that's kind of questions that we have. In the same time, there are since 90s, there have been lots of efforts put into elimination of the epidemic and accelerating efforts of Ukraine to end HIV epidemic as such.
And yet, and still, we do have the epidemic of HIV diseases in Ukraine. Why is that? Is this because people living in Ukraine or foreigners living in Ukraine do not know how to protect themselves?
Might be, yes. That's one of the risk factors that we still face such issues as unprotected sex, and that's one of the ways how HIV infection could be transmitted. And that's one issue. Another issue is that HIV is being concentrated still in key population groups. Key population groups, those are the ones that having the highest risk factor for transmission of HIV. Those are people who inject drugs, and this key group is also a rather close group, and to have access to that group is quite a challenge. Also, in Ukraine, there is, I would, if I may say so, there is a trend to a healthier lifestyle. For sure, we see the increase in that. But in the same time, how often do we go for checkup, for regular checkups to the general practitioner when we feel ourselves okay, but still there is a need to go to check up just because we might not see some kind of risk that we already have. And I think that's also could help us to end HIV.
Okay, the numbers that we have in Ukraine are higher than those demonstrated in Europe.
Yes.
Now, are Europeans more responsible when it comes to their health? Do they go to regular checkups, and that's why their statistics is not that bad as in Ukraine?
Healthcare systems in major EU countries are well established and well functioning. for a while. Ukrainian healthcare system has been facing major challenges since the independence since the moment when Ukraine got its independence. And we have had our ups and downs, and what we see even now is that we have, even though we go through the transformation and reform processes that are really are comprehensive in many senses, but still, Ukraine has had those challenges, and we also have quite a large group of key populations, what I already mentioned, the people that inject drugs, for example, or others, like men having sex with men, and those and how tolerant we are, and the way of stigma and discrimination is still the issue in Ukraine.
We're going to talk about it a little bit later. I do know that in LGBT communities, primarily in gay communities, there is such thing. They are being given the preventive pill, or
That's true.
Why aren't those pills distributed all around Ukraine among the key group populations?
They could be distributed, but at the same time, it just for the pilot project had been held by Public Health Center in regards to PrEP, this as a pills that could protect somebody who is in risk. They are not. They haven't been. Those pills were not available in Ukraine till now, and that's something that also needs some time. So that I'm sure that Center of Public Health in Ukraine, they work hard on getting this kind of drugs available everywhere, and also spreading information. And with the support of projects like our project and others, we can get more people to learn that there is that pill. The issue in Ukraine is something unbelievable, that not everyone knows that there are pills that are drugs to HIV drugs that could allow somebody who is HIV positive to live absolutely normal life, and that those drugs, RT drugs, are available in Ukraine, and they can protect basically the person from development of HIV infection, and then
passing it over to others, basically, right? And passing the infection to others, which is the most important thing.
Absolutely.
Right? What about the rapid HIV tests? Are they the hope that it's going to change the HIV situation in Ukraine?
Yes, we hope so. Rapid test, what is that basically? That's basically a device that allows us to learn about and then to inform somebody who is having HIV positive status quite quickly. So that is like 15 minutes, and then if the first screening test shows positive results, and another test, it's also like 15 minutes, so a little bit more, and then you already see, and the doctor can give the diagnosis, and that's elimination of time. So it's like we save time, and then we have more chances to keep that person in the care and in the system, and with the support of social workers, then to actually help that person to go to the treatment too. So that's something that rapid tests are definitely the devices that helps us to make this screening much more effective and efficient.
I'm guessing that the treatment of HIV infections is a complex of different measures, and psychological help is just one of them. Could you name all of the parts of that complex, and why HIV-positive people do need psychological help?
Yes, thank you. That's very right. Psychological help is something that is definitely needed for HIV-positive people, and also social services as support. Why? Because there are different what is HIV, how it seems, how it being perceived by the population, and also by somebody who is learning about his or her status. It's something that like, okay, my life will end. There is no future. I'm HIV positive, and how will I live with that? Like, there is no hope. They like immediate feeling of that something that my life failed.
The life is over.
The life is over.
Right.
But in fact, it's not true, because we have pills, and that person can live absolutely normal life, having children born with no infection, etc. And therefore, we need such a support as social services and then psychological help to help that person to go through this process of acceptance that, okay, yes, this is disease, okay, I'm infected, but see, I can actually, and there are there are people that live through that, and I can live through that too. And to help that person to get better in that kind of sense, like psychological, I think that need is definitely needed.
What is the level of tolerance towards HIV-positive people among Ukrainian population? I'm guessing it's not really high.
We will see. We have upcoming Stigma index research. That is a huge research that is being conducted every 3 years globally, not only in Ukraine. And we will see. We start already this year, 2019, and 2020. We will have some results there. We see that actually tolerance, or let's say discrimination and stigma towards HIV people, is getting down. So it's decreasing, and that's a nice. It's a beautiful trend, and we see that that helps also to get those people to treatment, to get HIV people help, and to get them to treatment, and finally to live to enjoy the services as others do. I think that's something that is I would like to stress again, that when a person is HIV person is getting treatment. There is a great chance, and that after 6 months, that person could become absolutely safe to themselves and to others. So there is such a undetectable, untransmittable. So when then the virus is not even could be not even seen, and then therefore when the person already get to that point, that person is becoming absolutely safe. And what I think that should be well known around the population, that it's not something, as we were talking, sometimes end of life, or that the HIV positive person is unsafe. They're absolutely safe, and we need to treat it as any other chronic disease, like diabetes or something. That
brings me to my next question. I mean, diabetes is not something that is being persecuted in the society.
Yeah.
So people, let's say, while applying for a job, openly tell the employer about their status and about their disease. Should HIV-positive people do the same thing?
HIV status in Ukraine is being protected by the law, so it's confidential. No one is obliged to tell about HIV status. So there is employer if employer requires information on HIV status, that is a break of law. So it's prohibited. Whether or not to tell about HIV status, it's up to the person. Do they want or not? I wish that one day we will reach the level of tolerance and here in Ukrainian society, when that would be just okay, and won't be something that's seen as failure, and something as seen as unsafe or dangerous. So I hope that we will.
There are some groups in the Ukrainian population that are highly tolerant of people with HIV-positive status.
Yeah.
Hopefully, that number is going to just increase and grow bigger and bigger with years to come. Thank you so much for coming.
Thank you very much, Antonina. Thank you very much.
That was Khrystyna Brodych. She's the director of the USAID HealthLink project. Thank you so much for watching UATV. Stay tuned for more.